I'm going to share with you. So possibly you all are knowing this, but it is important for me also. So I will start with this slide. Why it is okay. So being entirely honest with oneself is a good exercise that I do believe. That honesty in doing the work, while reading, while being with the patient, while treating the patient, and whenever we have to say that this I cannot handle this case and you may have to go to the another homeopath or another specialist, that also comes under all this case management part. But at present we are going to have our focus on the case receiving or case witnessing or whatever name you give it. But the basic purpose is to know the person in front of us who is came in form of a patient. And I always believe that the more I read, the more I acquire, the more certain I am that I know nothing. So whenever any of the patient who comes as a new case, and if we believe that we are knowing something about his disease or his details, almost it is fraction of the thing. So it is really difficult to know everything. At the same time, if our eyes are open, we can see things worth seeing. So here comes the part of observation. Not only through eyes, but through our ears, our perceptions, everything. Whatever you see, observe it properly, then most of the case become comparatively easy. And that is what we have learned also from the various kind of the masters. I am going to give a list of the masters, but probably whatever good homeopath has been in our field, all has contributed to this art of observation. And we must pay our first attention to our master's oath, that we all understand, we all know that the oath is there, Dr. Hahnemann has said this, but to apply into day-to-day life practice is one of the most essential part of each day practice. With each case, whether it is an acute, whether it is an acute exacerbation of the complaint, or whether it is a chronic case, whether it is you are seeing in the very crowded OPD or in your own consulting room, everywhere this oath remains our central line. And whatever advantages I have come across, these are these advantages. That's just I'm putting across you that I have to, okay, just sorry. So we can come across various kind of the diagnosis after passing my graduations and started homeopathic practice. And I have even not heard the name of the diagnosis. That sort of the diagnosis I came across whenever the patient comes with the reports or patient tells the diagnosis. I again go to the textbook of medicine, again go to the textbook of pathology, and again I have to read and read and read. And then finally I understood that it is a never-ending process. So many diagnoses. So it is beyond our imagination, whatever we are learning in our academic career. Patients comes beyond it. So we can understand or we can come across many of the diagnoses. The same way, various kind of the investigations. Nowadays, the investigations are so sophisticated and different names. So to even remember the name of each investigation, that is also a difficulty nowadays. Various kind of the people we can meet in form of patient, no doubt, in form of patient, various kind of the patients. Then comes the various kind of the life situations of the patient. In different life situations, people are living and people are enjoying their life or they have difficulties in life. These all situations we can at least witness or see through the our patients' details. Then comes the hobbies, the various kind of the hobbies. Recently, one of the very young MBBS student who just came for the severe anxiety problem, he just mentioned that I have seen great hobby of having horse riding, and he's already doing it hobby very well also. And now probably he has already dream of that he may change his profession. Being a MBBS, he may cultivate horses and will uh, invest in a very good farm and will train the horses. This kind of the hobbies we can see. Various kind of the emotions that is comparatively common to all of us. That as a homeopath, we are facing many kind of the emotions from the patients. Various kind of the imaginations. We can understand a person at depth also by doing all these things. And the greatest advantage one can have that we can be a witness to all these things. And if we can, it is a great thing for us also. So let us move forward. So all about that is knowing our patient. Up till now, everybody is comfortable. I think probably Srishti can give feedback, voice feedback. It will be a better thing for me. So
Yes,
whether
sir.
I am audible properly and slides
Sir,
are smooth. Huh?
yes, sir, sir. Good, but some participants are having trouble with the voice echo.
Voice echo.
Yes, sir.
So probably some of the microphones will be on that can cause the echoes.
So, sir, can you do you have an earphone or something that you can connect to the computer?
Not at present, probably. Echoes are there. It's difficult. Should I use my microphone?
Yes, sir. Yes, sir.
Set up just a moment. If
Yes,
it
sir.
is possible, I can use it.
Yes, sir. Yes, sir. Please use it.
Bit difficult for me also. So now the echoes are there.
No, sir.
Hello,
Perfectly clear. Yes, sir.
perfectly clear.
Yes, sir.
Okay, so okay, so up till now the slides are clear or not?
Yes, sir. Slides are clear.
Okay, thank you, thank you. So knowing our patients is one of the most important part, as we all understand. And regarding knowing our patients, what I have come across, these are the most important part of a person, that we all are combination of all these four facets. Then open self means information about you or we, that both you and others know. So we know about ourselves as well as other also know about the same thing about this ourselves. Then comes the blind self, that information about you that you don't know, but others do know. The same thing has happened, that the echoing is are there, but I was not aware of that echoes. But some of the people are aware of that and they have just mentioned, so we can correct it also. Then comes the hidden self. Information about that you know, but others don't know. So many of the things, many of the, suppose any of the addiction, many people don't know about that. But you know that you have that addiction, you have that kind of attitude, you have such kind of the prejudices that you know, but others don't know. And there is a fourth facet, that unknown self. That is information about you that neither you nor others know. It is almost hidden part. It remains at a depth, and sometimes in glimpses it comes, but Very few people can register it. So this is what known as unknown self. Why I'm doing this exercise? Because what we are going to do is basically to understand a person. And person is having a personality. And there is a personality, the word has been given by Sigmund Freud. Persona, that is what a kind of mask. And this personality have certain facets or certain compartments, which if we are aware, we can utilize it in a proper manner at a proper time. So whenever any of the patients comes to us, mostly he will start at a conscious level. Then if we inquire a little bit more, then we can have a pre-conscious data that stored knowledges or recalling capacity or memories or all the incidences. In general terms, it is called as a past. Then comes the unconscious level where the fears, very, very unknown fears, some difficult motives, some immoral urges. The same thing has also connected with the ego, superego, and id also. So that we will not go into the depth of psychology, but these are the compartment. If we are little bit aware of all this thing, it helps us to understand a patient in a great extent. This is what we are doing also. So this is what we are talking about, the mask. This mask we all are wearing. Most of the people, very few can remove their mask and be what they are. It is it is itself in an achievement, but it is really needs a lot of patience and practice. The same way, this is the current mask we all are wearing at present. And that's why sometimes in lighter manner, I call this masking the mask. So we are already having a mask and we are just putting a one mask more. And now for the double strain or mutated strain, it is called said that one has to wear two masks together, 195 and one common mask. So these are all the wearing the masking the mask. So now what we are coming to the topic, that case taking, if you call it case taking, case receiving, case witnessing, case perceiving, case understanding, case knowing, whatever name you give it, but the process or the essence remains the same. So whenever we talk about such words, mostly we convey that we are really interested to understand a human being who come to us in form of a patient. As per my experiences, nobody come into contact with anybody without a purpose. There are always a purpose. We may not know it properly. And what kind of the cases we generally have? Children cases, youngsters, adults, senior citizen, and nowadays super senior citizens. Then the category, this is the age group. Then uneducated, educated, highly educated, all the three variety of the cases we can have. Then comes the students, employees, employers, industrialists, government officials, and politicians or religious people or religious masters. This all sort of the person can come to us as in form of a patient. So our approach to understand a person or to know the person can almost cannot be a fixed criteria. It can be flexible enough. Then comes the what types of the cases can come again. So expressive about their chief complaint. They express the chief complaint in a very well manner. Some people can express themselves too with their all the good intention and good qualities. They can tell us their emotions, their intellectual capacities, their qualification, etc. Some are inexpressive. Some are shy type or timid also. Why you need to know all these things? This kind of the question many of the patients ask. and some are unaware type. They don't know about themselves. They are not so much aware that they can notice their own physical things as well as the mental thing. Generally, we use this kind of the case papers also. Short case paper. Suppose if in a crowded OPD, we have to use the short case paper, which can be comparatively easier to fill it up as well as we can keep the record of the same. At the same time, long structured case paper, that is also probably all the people who has passed out from the college have used to this kind of the long case paper in the journals. Then comes the plain paper. Plain paper means nothing has been written on the paper, purely plain paper. And you have to write down in the language of the patient. This can be the one of the best paper also. Then computerized case paper. Nowadays, most of the softwares are providing the case papers also. So one can type it down in the computer. And the another aspect is the web-based case paper. So people used to use this case paper for the online case taking also. Then comes facts about the case understanding. So generally we are coming into contact with the people. Our observation starts, our communication starts. We have to do medical examination also, that is clinical as well as the seeing all the investigation reports, showing interest about patient and his life, listening his life experiences and reactions, taking interest to understand his viewpoint, understanding the person and his problem. This all are the general thing which we have to do in the case taking. That's why I am just elaborating it to you. Then comes what are the requirements to understand a patient. As a homeopath, I follow this. First, appointment. If you can give proper time to your patients, it will be the best thing you can do. Then comes the consent form. It is known as actually consent form only. That consent form is one of the most essential part of before the treatment begins. Then the time adherence. When you have already given the time to a one patient, you should be prepared enough to be there, available without any distraction with the patient. Then the privacy. The privacy is also one of the most important part because when you travel with your patient or when you go much into the depth of the patient, this is one of the most crucial part because with this only patient can open up very well. Then comes the processing part, that is record keeping is one of the best thing we can have because it can be very useful in the follow-up visits as well as our analysis of the cases, and in some way it can help in the research way. And one of the best case record keeping is I have found that is the video one. So I generally do a video of all the cases and all the follow-up visits of the same patients. So this is what my view of, because I can retain it in a language of the patient, the same language, same expression of the patient. That is why I'm keeping it record on the video. And certification when required. So whenever any patient comes to us and demands any kind of the certificate, we should be able to give the certificate to them because it is a medical duty also. The whole case taking process, if it is the more simple, the more will be the outcome. And most of the time, it should be spontaneous from the patient and effortless on the part of the homeopath. Space given to the patient is to express himself. Attention with non-judgmental attitude of the homeopath is the pillar of this case-taking process. If we are well aware of spoken language or local language of the patient, it is one of the best things. Knowledge of neurolinguistic language of the patient Means the gestures of the body language, just I'm moving my hands also, that you can see also. So if you are knowing the purpose of all this thing, or the if you are noting down it, it is one of the best observation. Then the level of awareness of the consciousness of the patient, at which level he is aware about himself, whether he is only aware about the diagnostic or the complaint level, or at a general level, or at a mental level, or at an imagination level, or whatsoever. This all can be noted down while he start narrating the thing. An empathetic response from a homeopath. So sometimes a good homeopath can have empathetic feeling also, and that can be a gift from the universal energies. This picture I like the most, that the art of knowing is knowing what to ignore. So patient comes with all the thing. So on what to focus and what not to focus, this is up to us. And this we can do it by patience and by practice. So this is the basic thing what we are going to learn, that fulfilling aphorism number 1 and 2 is our main criteria. We all know aphorism number 3, 4, 5, that is about the disease, about the prevention. This all we know from the organ of medicine. And we also practice aphorism number 6 of observation. But how to do that observations, that is what the problem. What to observe and what not, what to ignore. This part comes with the practice. So how we can start? Once the patient enter into our chamber, patient details the history of his suffering. What I'm actually narrating is the aphorism number 84. Those around him tell that what they heard him complain of, how he has behaved, and what they have noticed in him. So this is the role of attendant. What they have noticed about the patient. And what the physician or homeopath will do? The physician sees, hear, remark by his other senses what there is of an altered or unusual character about the patient. He writes down accurately all that patient and his friends have told him in the very expression used by them. In the very expression, the same, no inputs from the homeopath or physician. He is just writing down very attentively with fidelity in the tracing out the picture of the disease. Keeping silence himself, he allows them to say all they have to say and refrain from interrupting them unless they wander off to other matters. This is aphorism number 84. We are very much focused on the aphorism number 83, the qualities of a homeopath, the qualities of a physician. No doubt, these qualities are really very good, but it is very difficult to practice. And if you want to practice it properly, we have to focus on the 84 and 85 and onwards. So by practicing all these remaining aphorisms, one can travel to the aphorism number 83. Otherwise, it is very difficult to achieve or to develop such kind of the qualities without being in the practice. The physician advised them at the beginning of the examination to speak slowly in order that he may take down in writing the important part, whatever speakers say. Here I don't do this thing because I have already told you that I am using video. So whatever patient tell in whatever speed or whatever way, I generally don't tell them about you have to tell me in this way, because on that part also I don't want to be prejudiced. So if the video is doing his job and patient is doing his job, just I want to witness the whole process of his pace, his way of expression, his use of words, his tone, his what we call gestures, this all I can see in front of us in our consultation. So we as a learner, I have traveled all this, almost most of the people I read with very enthusiasm and learning spirit. So started with our old masters that Dr. Hahnemann, Dr. J.T. Kent, Dr. Moni Hossain, C.M. Boger, Creed Smith, H. Robert, Stuart Claus, Dunham, and old journals, which shows certain techniques of the case taking. And all this was in the beginning of my career. So it is difficult for me to understand the each one's language also, because these languages are comparatively not so uh, easy to understand. And the recent masters I have studied also after some time, that is started with the George Vitolkas, Ananda Zeren. Probably you may not have heard the name of the Ananda Zeren, that he has developed a theory of will, wound, and mask. So there will be a will, it is wounded, and we develop a kind of mask in form of a disease. Then this is what Dr. Ananda Seren from Europe has already told. Then the ICR model of case taking, standardized case record form, I have practiced a lot regarding about that, but I have first learned it from a very good friend of mine at Vadodara. In Jan Scholten's way of perceiving the case, Dr. Shankaran has developed certain new concepts, completely new concepts, the levels of the understanding. This is one of the marvelous steps toward the case-taking process. Then the Catherine Coulter has evolutionary totality and evolutionary aspect of the case-taking. Then rediscovery of homeopathy by Dr. Emil Segal. Now it is known as Segal's Brothers, ROHR. This is also on the interpretation of the small sentences into the rubrics. That is also a very important part. Then Michael Yakir developed the whole process of evolutionary aspect of the plant, and Dr. Mahesh Gandhi has given the module of personality evolution model. Then Farooq Master has took many of the trauma cases and cancer cases and all sort of the hospitalized cases. Jeremy Sher had developed the whole case taker process. Dr. Dinesh Chauhan has case witnessing process and journey into the human core. And Dr. Vijay Kar has also given a very good understanding from the embryological point of view, the whole what we call expression of the various layers of the miasms and the disease development. These all are very important part of learning. Nothing to avoid, everything inclusive, that can lead to a greater understanding of case taking. And what I understand, sorry, so whatever I learn, I generally start with the learning, implementing, checking it, improving, and experimenting with my cases, because this is the only way to learn and evolve. So first learn, implement in your day-to-day case practice, checking it with your results and checking with all the parameters whether you have done it rightly or wrongly, improvising upon the same and experimenting with the newer methods. This all can come to help us in a better way. And generally, the simile most of the time, that is characteristic expression, genetic dispositional patterns are always almost parallel to this, all the things from the cellular tissue system, physical constitutions, and all. We have to consider all the aspect of case taking, and again sensation, perception, experiences, psychological constitutions, and patterns of the person. This also comes in the case taking. So this is just an example. I'm not going to talk about it. So according to my experiences, most of the patient tell their complaints very well. Most of the patient, if we are ready to hear it properly, most patient will tell us most of the thing. Many of them are quite observant about it. If we listen them properly, they spontaneously describe location, sensation, modalities, and concomitants, if they have. And many a times, a pause with attention can be the best tool